Good morning and welcome, everyone. We'll just give folks a minute to get signed on, but while you're logging in, feel free to use the chat. Let us know where you're coming from, what organization you work with, and if you know it, the Indigenous traditional territory that you're on. One of the things that we do at Help Seeker is we always like to do land acknowledgements and encourage people to think about their connections to the land, their connections to their history. So pop it in the chat, let us know where you're coming from, and we'll get started shortly. In the meantime, I also just wanted to do a quick land acknowledgement for where we're joining you from at Help Seeker. Both Alina and I are in Calgary, which is obviously Treaty 7 territory. That's, if you don't know, that's the traditional territories of the Blackfoot Confederacy, so the Siksika, Kainai, and Piikani First Nations, the Tsuut'ina First Nation, Stoney Nakoda First Nation, as well as Métis Nation Region 3, and all the people who make their homes in the Treaty 7 region of Southern Alberta. So just want, as we think about working towards creating a more equitable social safety net, as we work towards thinking about, how we can create a more inclusive society and how we can, reconcile with our past and create a better future. Super, super important to be thinking about these things. So just wanted to make sure that we were including that. Up on our agenda today, we have quite a full agenda, but it's going to be super exciting, and we're really glad to be speaking to all of you about this morning. Obviously, our topic is the Data2Action project, and this is a really innovative project we're super excited to tell you about. We will go over the agenda, then we'll have some opening notes from Minister Jason Luan. He's our new Minister of Community and Social Services in Alberta. Super grateful to have him open up this webinar and to hear his opening notes. After that, we'll turn it over to Dr. Alina Turner. She's one of our co-founders at Help Seeker, to talk a little bit about the background of the Data2Action project, why we're doing this work in the way that we do. We'll show you some of the pieces that we're building out, including our systems map and dashboard. And then we'll get into the meat of the webinar, which is the panel discussion. So we've got 3 great speakers joining us today. We've got Lana Wells from the Shift Lab. We've got Dr. Elizabeth Baker from the Shift Lab as well, and Carrie McManus from SAGES, which is the backbone organization of Impact. So that's really what we've got for today. Again, super excited to be chatting with all of you about it. Thank you all for putting where you're coming from in the chat. For now, I will turn it over to Minister Luan to kick us off.
Good morning. Can everybody hear me?
Yep.
My name is Jason Luan. I'm the Minister of Community and Social Services for Government Alberta. Actually, this is my 3rd week being appointed for this role. Very pleased to have an opportunity to bring greetings to all of you today on behalf of Premier Jason Kenney and my colleagues in Government Alberta. Particularly so, I'm so excited to hear the subject, what you're about to discuss. For me, coming to this role is new, but it's not new for me working in this field. Some of you know me. I've been in the social work field for over 28 years, have been in various corners of the field, including I consider myself, this last leg is in the decision-making policy area. Let me assure you that on behalf of Government Alberta, we are very, very committed and eager to learn new ways of doing things, particularly using technology and data to drive for best practice and use evidence-based best practice to guide our work, including public policies. So as soon as I saw the invite coming in, as you can appreciate, for the first week coming to the file, the invite is thick. But when I saw this one, I said, I want to be there because this is really important work. and particularly during a difficult time. Those know Alberta, we're a double, triple whammy because of the economic downturn before the pandemic, and then the pandemic causing not only health crisis, but social crisis. And then economic double whammy because of all the health measures that we need to put in place to limit the virus, but also limited our interaction and how we support each other. Particularly in the field of domestic violence, let me tell you this: pandemic did so much damage on top of the well-known health issues, but in terms of people's mental health, domestic violence, it went even further to the degree in my briefings, the volume and incidents went beyond the normal level of scope. But I want to give credit to community partners like all of you. Many of you come today. You rise to the challenge and provided innovative community support services, helping Albertans overcome this challenge. We are very pleased as the government of Alberta. We rolled out extensive, timely emergency support, including 133 million spent in the social service area. I believe part of the project that started this one is from the civil society grant that we created. This is an indication to all of you that we're committed as a government working together with our community stakeholders. We firmly believe when we are at times of a challenge, we need to come together. Government alone cannot solve the problem, but working together, leveraging your knowledge, community partners' network of power influence, we can make a difference. And to me, this is the so-called Alberta spirit. We rise on top of the challenge, we go even further. I'm very pleased to hear from Dr. Turner just a second ago, give me a very quick high-level update of where the things are at. Pleased to know that Alberta is positioned to take the country, lead the country, using data and using technology and using AI technology inform social services practice. Let me assure you that as your minister for community and social services, as somebody who are also passionate about this field, as we are working together on this, you have my strongest support and my best wish that you will succeed on this. And I will keep my eyes on this to see where this will lead. And I will seek the advice and the support that you can come up from this technology evidence-based approach to help us to work together to make a difference in Alberta. I'm so excited about the contents. I wish I could stay for the rest of the day for this conference, but my schedule won't allow that. But let me leave it to this. I heard you're going to record this. I will take a look beyond my normal duty for the minister role, but just as a social worker, I want to know what the opportunities is presenting to us, what collectively we can move forward on this. What are the things we can contribute to help this go further? Without further ado, congratulations for all of you to putting this together, and very nice to see so many familiar faces, including my former colleague, Ms. Lana Wells, and I know we're in good hands for this very timely discussion, and congratulations again, and wish you succeed for today.
Thank you so much, Minister Luan. And we thought there's no way this is going to be one of your first appearances after the promotion to this new appointment. So we're so thankful, and I think it signals exactly what you noted, that Alberta is committed to this issue and it's committed to innovative solutions towards it. So nice to have somebody that has background in the social work space as well in this role. It doesn't come by very often. So we also so look forward to working with you. Thank you so much for being here.
Thank you, Dr. Turner.
Right. We will let Minister go because he's got lots of other things that that he's responsible for, and we'll move our agenda forward. So Jill, drop the next slide if you don't mind. There we go. So for those of you just wondering who we are, we always like to remind those that know us and those that don't know us about what Help Seeker is and does, really briefly. So we're a social innovation and social technology B Corp. So we're a lean, growth-minded, leveraging technology to disrupt in a positive way our approach to social challenges in Canada and one day beyond. So we're based in Alberta, which is also why we're so entwined with some of this work happening locally. We've got 53 staff, and we've got folks that work in data science, folks that work in technology development, but also in social innovation and systems change. So it's a really cool team. 53 was our last count, but I feel like we might be up to 55, but don't quote me on that. And also, for those of you that don't know what kind of products we develop in our team's work, we develop products for help seekers, so people looking for assistance, those end users, if you will, service providers, those delivering the frontline service, and then of course the decision makers. So this project on Data2Action really fits in that decision maker bucket, but in very much entwined with the other two. So we always try to have that trifecta impact on all three key groups. Our national partners are the Canada Mortgage and Housing Company as a key investor in our work and scaling Help Seeker nationally, and then the Canadian Digital Technology Supercluster. So truly that social and technology innovation is our backbone for sure. Next one. Okay, so a little bit about our key speakers today, and we thought you guys are probably really bored of hearing from us, and we're not as exciting as who we have on the board today. Lana Wells, you have probably come across her name at some point. She's a huge, I want to say creative or positive disruptor in the domestic violence space in such a cool way. So she's going to be representing Shift and University of Calgary. Carrie, who is the lead on innovation from Impact, which is a collective made up of 300 plus organizations across Alberta working on the domestic violence sector. Me, because you can't get rid of me, and Dr. Liz Baker, who is that really weird mix of data science and also social science as well, which are not usual combinations. I've only met two doctors that actually do this, and one of them we're lucky enough to have on our team, Omid, and then Liz, who's working with Lana on this project. So anyways, I'm so excited to have Liz on this, and can't wait to hear from her too, because we don't get to have these perspectives too often. So that's who's on the panel for today. We're not going to do the usual everybody presenting. We thought it might be more fun to do more of a panel discussion, but to contextualize that panel discussion, we'll take you through the background on the project as well. So next slide, please, Jill. Okay, so the origin story of the project. Number one, the data collection in the domestic violence sector, as anybody would know from across the country, is very fragmented. It's sometimes non-existent, and it's very much untapped because it is happening. It's just not necessarily being directed towards policymaking in a systematic way. So we thought that is an interesting origin to this project that we should highlight. The other piece is the lack of real-time understanding of need and how to respond, especially during this time of crisis. But the COVID prompt to this project is just another one in the series of crises that communities experience. And as Lana will reference, there's lots of economic disruptions that may happen at a local and regional level that oftentimes is connected to domestic violence jumps. So we know that COVID is a prompt, but it's not the only crisis that we're going to be facing. Domestic and sexual violence needing a systemic response. So we always talk about this need for systems responses, but then we somehow don't follow that up with any evidence to support it, and we don't follow the data to tell us what insights that might add to the discussion. And the last one that is of note is to validate this community call for change and the need to shift towards prevention. Again, we always say it's better to start with prevention. Really, really hard to follow that up with actually shifting systems. So we said, is there an opportunity here to come together to look at data and prompt this shift between all of us and our different hats? Next one, and I'm sorry, I'm going through these because I want us to get to the discussion. So the 3 partners, and I highlighted this before, our role at Help Seekers to be that social tech expert in-house, and the ability to develop some of these tools, the ability to curate and synthesize the data, visualize the data. Shift, they know the academic space, they know the best practices, they know how to critique the data in a way that we need them to, because data in and of itself is not unbiased, as some machine learning people might tell you otherwise, but we know that's not true. We need that critical perspective that understands the equity challenges that the data presents, and to call out our data science team when we're making assumptions. We also need Shift to put all that insight into the discourse as well, from an academic perspective and policy perspective. Impact and Carrie's work is so critical to this, because we often do academic work, we often develop technology in silos of the actual people that are living and breathing this work in practice. That's what Impact brings to the table. Their ability to shift the narrative in the sector, the ability to mobilize the sector to pay attention to this and to do work differently. So this trifecta is so cool. I haven't seen it done before, and that's why we're so excited to be part of this. And then our approach is this concept of a systems map, the service landscape, understanding what the services are in Alberta to do with domestic violence, visualize through a data dashboard what's happening across the province, engaging service providers to contribute data, and of course, to then take all of that and push it back out as insights to all of these different groups that are needing to pay attention to it. Policymakers, like you saw, decision makers at the policy level, but also service providers that need to be shifting practice accordingly. All right, next one. I think I described this one pretty well. We can go to this. So systems map, if you're wondering what this thing is, it's a dynamic inventory of Canada's social safety net. It's broken out by service types and various taxonomy breakdowns of what exactly these services are doing, who they're serving, etc. The whole concept is that if we can map the system, we can understand the system, so we can identify gaps and duplications, but we can also look at trend analysis over time to see where are some of the heat maps telling us pain points are emerging at a community and even neighborhood level. So that's what the systems map means when we talk about it. We have this for the entire social safety net, but we're going to be talking specifically around domestic and sexual violence today. Next one. So what does this stuff actually look like in practice, and what have we come up with as part of this work? As you can see here, it's a screenshot of our dashboard, and it's an interactive dashboard that all the members of the Data2Action team and the contributors to the data are having access to as part of this work. So we're able to look at things like service locations and what's being delivered there. But as you can see, we're also able to start looking at the types of service categories. So is it domestic violence, is it sexual violence, and also look at different regions. So looking at patterns of where we have service availability or service gaps. What's also interesting is what portion of the social service listings related to domestic violence are being represented in relation to the bigger social safety net. And that's important too, because we can see patterns of variance there too that are important to understand what might be missing in a city by comparison to another city. So this ability to look at things in a comparative lens is super important. That's the basic screenshot of what's happening in one community, but as you can see, we can drill into all of them further as well. So let's go to the next one. So snapshot of the observed need. So it's not just about supply, it's also about demand and real-time demand happening in a community. So same thing. What is the data that we have available that's already being collected rather than the data that we are demanding needs to come to us? So we said, let's start with the low-hanging fruit. So police reports, clients accessing support from service providers that are part of Data2Action. Let's look at this as in relation to what people are looking for digitally. Let's curate all of this different data as indicators of demand in a community, and let's look at that over time, and let's look at that in a regional comparative lens. So that's what you're seeing here as a screenshot. Again, it's interactive, so you can play with it. So we can see, for instance, trends over time and do that comparison moving forward. Next one. Okay, and I think this is our last screenshot. Same thing here, understanding where in a particular community we have services located, but also where users are looking for help. So those help-seeking behaviors, because of COVID, have increasingly moved online. So we've got an interesting opportunity to complement what the service provider community is reporting to us in Data2Action. And we have monthly data coming in from all of our data collaborators, and the team can tell you more. I think our tally is going to be at over 30. Is that right, Jill? Yeah, okay. So we've got the service providers that send us data every month. We curate that and we visualize it, but then we've also got data coming in from the digital space. So it's not just about who's showing up to the service provider door, but what are they doing online as well, and looking at that story in relation to each other. Really cool, interesting stories. And you can see at the bottom there, the spike and then trickling down, but it's something we need to monitor on an ongoing basis, because this is really a dynamic field and it differs so much community by community and in different timeframes. I think that's our last slide on giving you guys an idea of what we've been working on in the last few months. And Jill, next one. Oh, I'm lying to you, my bad. One more. Go back to the circly one, because yeah, this one. So this one's really cool because the other piece that we're getting from providers are not just the service providers at the front line, the counselors, the shelters, et cetera. We're also getting data from police and Alberta Health Services to see what's happening in the systems as well. So that's the other layer to all of this. It really helps us complement what we're seeing at the front door of those nonprofit and charity providers compared to public systems, compared to online help-seeking behaviors. Again, super, super interesting. A question just came in of whether we have an MOU. Oh, hell yeah, we got hundreds of MOUs happening at the same time. We'll tell you all about that. There's so much trust that had to be built over the last year since we started this, but I'm sure the panelists will highlight all of that when we get into it. All right, over to you, Jill.
And that was an awesome discussion. And I think you're absolutely right. There's so much opportunity for us to be looking at this data that already exists and it's already out there. So like, why not take it and put it all in one place? And why not think about how to do that in a more coordinated way so that we can actually start to tell these stories of what's happening in the sector? I'm going to turn it over to our speakers now for our panel discussion. And what we'll do is I've just got some questions, and if each speaker could let us know your thoughts on these. We'll just start with a few questions about the origin of the project and what sparked your idea or interest for something like Data2Action. So maybe Carrie, if you want to go first, tell us a little bit about why Impact wanted to pursue this project.
Great. Thanks, Jillian. And yeah, I think for us, the part of starting the project when we did was because as COVID hit, as we were all sort of reeling in our sector around what do we do, how do we respond, one of the things that I did was say, I'm going to look at all of the research that exists around natural disasters and to see what I can find in terms of the coping with domestic violence, what people expected, what people had happen, and see if any of that can be useful to us right now in this time that we can share out with community. And one of the things I noticed was that there was nothing. Everything was done in a retrospective sort of perspective, but we had nothing that we could actually talk about during this time. This is what actually happened and what I actually saw. And so for us, it started a conversation around, is there a way, because we as agencies are all doing this, and we're all collecting this data already, is there a way to be able to take all of that stuff, all of that information that we have and that richness of what comes from community practice and comes from community engagement, and then bring that all together and start looking at it and noticing what those trends are and noticing what comes from that. And so for us, I think that was the driver of, we all already are doing this, we have all of this data, but we're not actually telling any stories with it. And it's really frustrating when you're trying to then go to research to use it to help to support in the story that you're in, when it's not available. And so is there a way that we can help to contribute to that so that the next time a global pandemic happens, there's research available about what happened and what that looked like, and how communities engage together around it.
Thanks, Carrie. Lana, same question. What was I guess the academic interest, or what was the idea that sparked it for you to be a part of this?
Well, I think there's a few things. One, I've been slowly following Alina Turner and her help seeker organization. Alina and I have worked together for years. And I didn't really understand what she was designing or creating. And then I showed up at a webinar and I was like, oh my God, she is transforming the social service sector and using technologies. And we've kind of missed the fourth revolution around technology as a sector. And so I called her and asked, because in the domestic and sexual violence area, we really use kind of a few figures to help explain or describe the problem or the prevalence. We go to police reports or Stats Canada 5-year-old studies, or turnaway rates at women's shelters. And so that isn't the full story. And I've always struggled with how we actually understand the problem and the complexity of the problem. So I called Alina and said, would you work with us to think about, and Andrea Silverstone at the time with Impact, would you work on creating a real-time dashboard? How do we use big data? Because our sector's never really used big data in terms of trying to understand the patterns and issues and then what to do with it. We haven't used artificial intelligence or predictive analysis to better understand, even mapping what's happening on the ground. And I think with COVID hitting, obviously we were all going to virtual interventions. And so Alina and Carrie and Andrea, we all got in a room together and started to really think through what could this look like. And I think for me, the compelling why is we have not leveraged technology. We kind of missed the boat. We haven't been in the design. So even when Alina talked about data science and the design of some of these systems, we haven't been involved as social workers or human service care workers. And so in a really big way. So wanting to really understand, so then start to have to dive into data science, artificial intelligence, predictive analysis, algorithms, like what does all this actually mean? And took quite a bit of time to even bring ourselves up to speed. We got a sense of what the project could look like. And then obviously we started to pitch it to different groups and specifically impact members, because I think as Carrie mentioned, people are collecting lots of data, but we're so siloed and so competitive in our sector. And because we have all of this diversity of funding and multiple funders, we're all collecting very different things for different reasons and not in consistent way. We don't have typologies. We don't have understandings of definitions. Even when you look policing, the Calgary Police and Edmonton Police collect differently on domestic violence or spousal assault. So you can't even, there's no apples to apples or oranges, so as someone said, a fruit salad. And so wanting to pull all that together and start to get really clear about what are the key, what are we learning from open source data and big data? And also what are we learning from organizations that are already collecting, and what are they collecting and could we collect better? And so we do hope that this will also build the capacity of the sector to want to collect better data, to share their data. And we're pushing government to actually use real-time data. And I think that's the other piece. Often we'll do retro, as Carrie mentioned. We're not doing like emergent, adaptive, what's happening today. And Alina and I have been scouring, like globally, rates were going up all over the world in terms of domestic violence, sexual violence. There was lack of supports, and our sector, it was having a hard time, I think, turn into even virtual. We don't even have systems in place in most organizations because we haven't been investing in technologies. And so I think those were all the reasons that brought me to the project.
Thanks, Lana. And Alina, nodding your head at a lot of the things that Lana's saying.
Oh yeah.
Can you tell us a little bit?
Sorry,
can you tell us a little bit about? I mean, all that Lana just mentioned, but really kind of what the value add of this tech perspective is when we're thinking about all these questions. Like, why do it with data science? Why do it in real time? Why do it with tech at all? Because that's not something that the social sector has necessarily done a lot of before.
I was nodding and laughing as Lana was saying it, and in some ways she thinks I'm ahead of stuff, but I'm actually not. So it's me too, realizing like, holy, this revolution around us, the digital revolution is happening around us, and us as the social sector have just I don't want to say we missed the boat, because we have it in our personal lives. So this data is already being collected about our behaviors, but we're not influencing the ethics of it, and B, we're not leveraging it when it is being collected to do social good. So that's this whole point of what Help Seeker is about, is, you know, how can we develop these digital solutions to influence how tech is developed in a more socially conscious, ethical way? You know, can we use technology to advance reconciliation, for instance? I think we can, right? Can we use technology to disrupt some of the oppressive practices we might have built out over the last 500 years in Canada that, you know, that are not necessarily doing the good that they're intended to do? I think we can. On the other hand, the tech sector is also developing tools and collecting data that are being used to not necessarily advance equity and social well-being for everyone. So can we also be disruptive in that space and raise the bar on what tech could look like? That's what we're about. Now, how does this relate to Data2Action? I mean, to me, it's like a no-brainer. Obviously, I love Lana, and we go way, way back. And actually, she gave me like my first job in Calgary. So we have that trust between us. I have also known Andrea at Impact forever. And, you know, I was on the funder side and she was on the provider side. So we always would get into conflict, but we always had that mutual respect for each other. And I respected her and Lana so much. So the point there is that there's trust, because you need trust to be going into this kind of work together. It hasn't been done before. Now we're going together to the sector. The domestic violence and sexual violence sector is obviously very, very cautious about data sharing, and cautious for a really good reason. So how do we actually build the trust between us as a project team to call each other out? There's so much argument and tension internally that is so positive and creative from my perspective. I love that. And then how do we scale that out into the relationships we're building around this project? Without trust, it's not gonna work. We're literally asking organizations to send us data every month. They're not forced to, they're doing this voluntarily. So they have to see the value benefit. And so that is also part of why we're doing it, is how can we do this tech work embedded in community and showing value the whole way through. That's what I would say is in it for us, compared to, I don't know, I'm not sure why that's special, but but that's why, for sure. Thanks.
My next question is for Liz and Carrie. Alina just talked a lot about, you know, how do we build trust and how do we make sure that all this work that we're doing is actually valuable for community. Can you talk about some of the ways that the Data2Action is looking to build trust, or what some of the barriers are that we're trying to overcome with that?
Yeah, absolutely. I think what's super interesting for me is, you know, at SAGES, we've been backboning collective impact initiatives for, 30 plus years. And so we're not new into this into this idea and this area of building trust and collaboration and working and having people work together. One of the conditions of collective impact that lives in all of the research is shared measurement. And what's fascinating is, as I've traveled around the world and I've talked to people who are doing collective impact initiatives in domestic violence, in homelessness, in food insecurity, and anywhere across the globe, what collectively I hear from people is, yeah, we do all of these things, but we haven't figured out how to do shared measurement yet. We don't actually have a mechanism for that. And so it's super interesting because I often think that's like an us problem, that's in our sector and in Alberta, and we haven't figured it out. But it's actually a really global problem around this idea of collective impact and shared measurement and having the trust. And, you know, Lana talked about the competitiveness and the, you know, the I think lack of funding, or this feeling like there's this lack of funding. And so we're all competing for the same pot, which I think are all of these things that sort of contribute to shared measurement. And so for us, I think one of the consequences of this project and of starting this project and saying, hey, collective members, why don't you give us your data? And people going, whoa, hold on, what are we going to do? What are you doing with it? What's going to happen? Was that we recognized that actually for the shared measurement piece, we had to take 5 steps back and start doing a lot of different pieces of work around. Okay, people who are ready to share, great, let's have them share. People that aren't, what's going on? What's happening that you need to know more? Do we actually know and understand data science? Because we don't. Do we actually know and understand what it is that we want to be doing with predictive analysis? Because I don't know that we do in the sector. And so recognizing that we actually have all of this work to do, that our lack of trust comes also from a lack of knowledge and a lack of understanding. And so how can we build that understanding and that knowledge and empower people to feel like they know what's happening with their data, what their data story tells, and therefore they are comfortable sharing it because they feel really empowered around it. And so I think that for us, that's one of the really big things around that trust, is that before we can actually build trust, we actually have to empower people and we have to build knowledge and capacity so that people then feel like, I understand what you say when you say you're going to take the data and you're going to do this thing with it. And I can ask questions about the pieces that I'm not comfortable with. And therefore, then we can step into this kind of relationship. And so I think that having to take multiple steps back in order to take the steps forward has been a really interesting and important part of the trust, and of the trust, I think, even amongst the team as well. And Liz and I have had some really fierce conversations around, Liz wants to do a thing and I say, whoa, we need to take a bunch of steps back about what this sort of looks like.
Yeah, and I think a huge part of that too is not just the knowledge and awareness, but how do we get them excited about it? Where's the motivation? Because, you know, for someone like myself who does research in data science, kind of like Alina said earlier, like it's, well, of course this makes sense. You know, why wouldn't people want to use data in tech? But it's making sure that it's useful for them too. And this is kind of a theme I think that has been throughout this conversation, is that the research that academics have done for far too long has been too far removed from what is actually happening in the sector. And so being able to work alongside them to make sure we're asking the right questions is really important, because as academics, we're in this really privileged position where we have the capacity to do research at a large scale. And ultimately, what we want to do is we want to tell the story of all of Alberta and hopefully all of Canada. But in order to do that, it takes a lot of organization. But that's what we need to do to have a collective voice, because the unfortunate reality oftentimes is that, you know, an organization can come to a policymaker and say, here's what I found, and that's really important and there's value to it. But it's not always heard the same way as compared to coming and say, you know what, we actually have this data from 30 organizations across Alberta, across time, across different contexts. And so we can kind of really help to strengthen that. But yeah, it's hard to find a team that can kind of do both of those and work alongside, and knowing that it's not going to happen overnight, but rather it takes a while to build that.
Thanks, Liz. And all super excellent points. I think that you're absolutely right. There's a lot of work that needs to be done in terms of, you know, building that capacity for people, building that trust, building that that relationship. And being able to have these conversations about how we're using data, or, what we could be doing better in terms of, using technology, using data for systems change. I know that we have a lot of service providers in the audience here and lots of people who do work in the social sector. So we'd like to hear your thoughts as well. We've got this activity pulled up so you can use your cell phone, use the QR code, or go to slido.com and enter the code. And let us know your thoughts. What kind of capacity building do you want to see in the social sector related to data collection, related to data science, technology in general? Let us know your thoughts. We'll keep this open for a couple of minutes just to see what kind of responses are coming in.
And while people do that, Jill, there's a question about RCMP and collaboration with RCMP. I don't know if you wanted to give a quick update on our progress on that front, because obviously we've got CPS, or Calgary Police, and Edmonton Police, and Lethbridge Police, which are municipal police forces. I do know RCMP is on our hit list for data collaboration agreements. Any updates on that?
I do believe that we have some data from the Grand Prairie RCMP. If I'm remembering correctly, I have a list. So Ajay, if you're interested in that, you can send me an email after this and I can give you the actual information. We're looking at getting that provincially. We don't have those agreements signed yet, but something that we're definitely interested in. I think that RCMP data can add a lot of value, especially for those rural communities, those communities that aren't necessarily having the most access to other services. Lots of times that's the place where people go. So yeah.
It almost becomes de facto.
It's in the works. Yeah.
Oh, that's great. And yeah, we've done some work with police in other contexts, and I know Lana's really involved with the Calgary Police here too. So that also is about trust building with these bigger systems, and I'm super actually hopeful around moving that forward and at that provincial level too. So we've had some good conversations already on other projects with the command for Alberta RCMP that we're going to be able to tap into. So for sure, this is not a be all end all. We constantly add new collaborators. I think we add collaborators every month. I feel it's 5 a month or something like that we have on to keep pace. And then another question is, have we approached in Ontario Mire, I'm going to mess up these acronyms, OCRCC. I don't even know what that is. Ugh, so I guess the answer is no. AOVF to have as organizational members, but maybe my colleagues, Carrie or Lana, do you know what those organizations are? And do you want to speak to our kind of like national aspirations while folks finish adding their poll answers here?
Yeah, I was just going to say, I didn't know the acronyms either, so I actually just Googled both of them, and we will be in touch.
Yeah, we have a national proposal that we submitted to the federal government to try to scale this and to be part of the National Action Plan to Prevent Gender-Based Violence. And we've been trying to advocate at that level to adopt this as a strategy to collect data and to be able to tell the story. So we've been lots of conversations around that. And specifically, there have been, I think, Alina, if you want to talk about Help Seeker, you are across Canada, but in terms of those specific organizations, they haven't been necessarily in touch per se.
Yeah, well, for sure, like our systems mapping stuff, like the mapping all the services is happening across Canada. I think we're at 280,000 services across Canada, which boggles my mind. And we're just starting Quebec. So yeah, we've been brushing up on our French and haven't finished the East Coast. So, and we know that's just scratching the surface. So it's a huge network out there, which is awesome. Now it's about like, how do you bring it together and think about digitizing certain aspects to make it easier to navigate is what we're looking at. But yeah, on Data2Action, fingers crossed that there's value seen in this type of approach from a national perspective to move this forward.
Can Can I
Yeah,
jump just because there's the one point about Alina, if you look up from AJ Mason, so you know about the Canada's North and that they're policed by RCMP, and so hard to get MOUs, and you know, we could take this offline with AJ to talk about that, because sometimes those issues are used as excuses. And we've been able to work through some of that. And I think what Alina alluded to earlier, having close and deep relationships and trusting relationships, and obviously MOUs in place. But there is, we'd be happy to chat, I think, from the Yukon, because I can recognize that the small number also, right? There would be privacy issues, and I don't know, Liz, too, if you like how, you know, when you have smaller numbers, and maybe Alina, you could talk about that as well, like how you address that anonymized data.
Yeah. Oh, I'm going to give that one to our data scientist, actually. Go.
Yeah, so a lot of times, yeah, when we collect data that comes from locations where the numbers are small, we have rules set in place before we look at the data to say, you know, if there's less than this amount, then we can't say there's a name attached with that, because while you're never 100% sure, it's possible that someone could look at that and say, you know what, I might know who that person is. And so we are very careful with that and make sure we have ethics in place to prevent it. But there are a lot of ways to still collect that data and to give a story of what's going on in the North, that will still make sure that there's representation, that we're talking about those people and that we are having them in the conversation. But yeah, just always have to be super aware and conscious of anonymous or anonymity. I always say that incorrectly, but I think I got it that time. So yeah, there's still a way to do it.
And while you,
I just want to take a minute to talk a little bit about the police piece, because I think that while it's super, super important to have that system represented, I also think that one of the things that a project like this does is it actually allows us to move ourselves away from our reliance on police data as the data that tells us the story of domestic and sexual violence. Because I think that we all know, and we talk about this openly in our sector, and I think, you know, even police talk about this openly, that most people who are experiencing violence don't report to police. And so when we rely on only police data, or we sort of look at police data as a foundation, I think sometimes we lose the opportunity to get the full story of both what's happening in community, the help-seeking behaviors that are happening, which is where I think that open source data comes in and is so important to be able to look at what's happening from a help-seeking perspective. What are people actually looking for? Is that landing in community, and is that landing with police? And really look at those places where they separate. And then the other thing that we've often talked about with this project, and we're still really working out the sort of nuance of how you do this, is collecting data from informal supporters. So most people are talking to informal supporters. Most people are talking to their friends and their family, or their, you know, pastors in a church, or their community members and community leaders. And so one of the things that I think is really important, and I want to be making sure that we're looking at as sort of in the next phase of the project, is how do we actually tap into those data sources and those data points, because they're most likely informal supporters, people who aren't, you know, us as sector people, we have to keep track because we have funders, and so we have to have a list that says how many clients do we have. Informal supporters don't, but they're doing the bulk of this work. And so how do we actually connect that in and bring that data in? And part of what I'm really excited to look at is how does that all sort of lay out when we look at informal supporters, services, police, and help-seeking behavior? Because I think that we can learn a lot from that. And so just for people who are sort of looking at police as a barrier, I would encourage you to start with other sources, the community sources that you have, those informal supporters, all of that, because it might help to get police on board once they see that there's pieces that are working already.
Thanks, Carrie. And yeah, that's totally the beauty of this project, right? And we're not quite there. We're not able to collect all that informal data, but you know, that's really kind of what Data2Action is about, is like, there's so much out there for us to take advantage of. There's so much information that, you know, doesn't get captured, or we don't always have a sense of what those help-seeking behaviors are. So this project in a way is sort of like trying to marry all of those or trying to bring them together so that we can be able to pull some insights. I just wanted to go back to this activity. In terms of capacity building, people are, most of our comments seem to be really around training. How do we collect data and how do we do that in a consistent way? Absolutely. It's so difficult for us to be able to compare information or to, have those shared metrics, to be able to tell a consistent story when people's data doesn't necessarily align. So part of the work too that we're doing with Data2Action is looking at, okay, what's the current state of data that does exist out in the sector? Is it the information that we need? Is it the information that we can tell a story with? And what we're finding is that, we can tell a certain amount with the data that does exist, but there's still a lot of work to be done in terms of like thinking about how we collect, what we collect, why we collect it. And so that's also part of this project too, is like uncovering some of those gaps in what data does exist. So thank you everyone for your comments on there.
Julian, can I ask a question?
Of course.
I would love Liz to talk a little bit about the research committee, because I think we have a structure on this initiative as well, very purposeful, to add in additional research questions to understanding what's actually happening with all the data and how to inform prevention. And so I'd love Liz to chat a little bit about that, because I think that will give people context to some of the questions that are in the chat box.
Yeah, definitely. So I think first to just kind of talk about, why is there inconsistency across organizations with the data they collect? And first, let me just say, even as researchers, if they're strictly academics, there's still a lot of inconsistency where I see projects and I'm thinking, oh no, why are you collecting the data this way? It's so bad. And so this is a problem that's across everything. And I think part of it to be aware of is the fact that each organization is different and they are collecting information that is relevant to their services, to their populations that they're serving, and all of that is important and should be continued because it's useful to them. But oftentimes what's missing is having these overarching research questions that we all agree on are the right questions that really are going to ultimately serve the people that we're trying to help. And so what we've been doing with the Research Advisory Committee is just trying to take a step back and say, well, wait a minute, now, what are these questions? So trying to pick a few research questions, and that process is not coming just from researchers. It's something that we want to have a really collective conversation on. So talking to those who are in the sector, to policymakers, to a whole variety of people. And so the first step is saying, okay, what are those research questions? And that's something that everyone's involved in. And then after that, what we do is we say, okay, from a research and a data science perspective, what does it have to look like? Like, what does the data have to look like for us to be able to answer those questions? And so we can create a template, which is great. I'm so glad that I saw that coming up here, that is very user-friendly, that we know that if people can just plug in certain bits, similar to like you would for like a survey or like an Excel spreadsheet, then we can take that. We know the data that's coming in is going to be very usable. We can do a lot of things with it, and then we're able to answer those research questions. But so often we don't have this kind of overarching system to help us do this and to do it at a really big scale. And so, for example, something that has really been coming up is understanding, where are the gaps in services that are being provided. So we're trying to take a step back and say, well, how can we answer that with data? How can we make sure that from my perspective, the data is going to come in clean, where I can analyze it and understand exactly the story that's being told, but then also understanding, having conversations with Carrie is, well, how do we do that in a way that service providers are, they're comfortable with, and we know that it's going to align with the work that they're doing. So it's juggling a lot of pieces in that way.
Yeah, I think one of the interesting conversations that Liz and I have had is how do we make this, how do we make the data something that service providers collect because they see value for themselves in their work and the clients that they're working with, and not because we're doing a research project and therefore we want to ask research questions. Because I think when we ask research questions, it's yeah, we'll ask that for the period of however long this project lasts, and then it maybe doesn't become ingrained and necessary. And so How do we look at what are the things that we actually need people to be asking to be able to fully tell the story, and bringing them on board with that so that it becomes a bit of a continuous habit of asking those questions, which also contributes to research and not just a research as a standalone.
Jill, did you want to introduce this this next activity? And we've got some really good questions coming in. So while people answer, we'll start knocking some of these out as well. Go for it.
Sure. And yeah, I totally agree with you, Liz. Part of this project is figuring out what questions we need to ask. And you're absolutely right, Carrie. Like once we know what those questions are, how do we scale that? How do we make it easy for people to contribute that data and to follow that format and to make sure that they're contributing in a meaningful way? Like we said, part of this project is figuring out what's valuable for community and what people are interested in. What kind of information would help them, with their systems change work, with their prevention work. So let us know in the activity again, you can go to slido.com and enter the code on the screen. You can use the QR code on your phone. Tell us what kind of questions you're interested in having Data2Action answer, and then we'll see if there's any room for us to, build that into our system. If there's any room for us to, use Data2Action as an opportunity to answer those questions. And while those answers roll in, Alina, did you want to take some from the chat box?
I love this one about a really critical analysis by Jay Hurst or critical question around gaming search engines. And we all know about that because we were all victims of really effective marketing campaigns that sell us a bunch of stuff we don't need. And you're absolutely right. Like you can't just look at search engine query results in isolation. So, and just the same way that we can't only look at police reported violence in and of itself, the magic of this, in my opinion, at least, is looking at 30 things at the same time and seeing the connections between them and what are the stories when you try. It's not even about triangulating because that implies 3 things, but like quadruple, 1,000, 100 times, looking at all of them at once to see what they're telling us overall, what they're telling us about each other. Like is police going down, but digital search going up? So is this what service providers telling us is going up, but what police is telling us is going down? There was a question early about healthcare. Absolutely, we've got Alberta Health Services that is one of our data contributors, and we do get data from them as well. We get phone line data, so who's calling the assault lines for assistance, who's calling the 211s for assistance, so we can actually bring all of this together in one place and then ask these research questions of all of the data. So if you only look at what Google tells you, obviously it's going to be really, really biased. If you only look at what people report on the helpseeker.org site when they look for help, that's only one part of the story. But if you're seeing things kind of line up in a particular direction, when you layer it all together, that's interesting. So that's how we manage that risk. Obviously, we're never going to get at, telling Google to do business differently or marketing firms to do business differently, but it's an important part of the story. And again, if Liz, you want to jump in on anything you guys might be doing around the search engine challenges that we might have, that might be a good spot.
Yeah, definitely. So I think the thing to note here, and it will tie in with Hal's question here, is that we are being very intentional about what our questions are, what our hypotheses are, how we're going to analyze the data, and everything up front. Because oftentimes, I've been using this phrase, we want to tell a story, and we do, but we're not just telling a story with the approach being, look, we've got all this amazing data and we're just going to pull things for it. We're going to use, AI to say, what are the patterns? Because there's a lot of danger in that, where you can pull something that, might be there, that I know from a stats background could just be a spurious or like a coincidental thing that's showing up in the data that we're only seeing because we have a lot of it. So that's a danger of statistics, is that oftentimes when you look for things, you're going to find it, but we don't always know if that's a meaningful result or if that's something that is actually true. A lot of times there are variables that we're not collecting that might explain that. And so a big part of my role is coming in and making sure that we do not do that. So I am the research type A person who's coming in and saying, what's our research question? What do we think is going to happen? How are we going to answer this? What are our hypotheses? And what is going to happen if we see this? And what's going to happen if we see that? To make sure that our interpretation is not just telling a story, but that it's founded in theory, it's founded in other research, it's founded in the conversations that we've had with all of the service providers. And yeah, a big part of that is with Google. And a lot of times I've been the one to say, well, let's take a step back, because there's so many things going on with Google where we just don't know, for example, if it's only help-seeking behaviors. And that's a conversation we've had a lot about, because I'm a researcher, so I type things in and I'm doing it for my job. But if we see that come up in the search and we're thinking that it's all help-seeking behaviors, that's an inaccurate portrayal of it. And so we're being very cautious to have these conversations with multiple people to make sure that that's all in our mind. So I really appreciate that question, Hal. It's something that we're very aware of and that we've got a process for.
Liz, and while you're at it, the other question I think is going to be in your ball court is the template or the new data collection for service providers that is being developed so that it creates that consistency. If you wanted to speak about the kinds of data elements that we're asking folks to contribute, because at first we were getting so much data. Everybody was sending us everything and it was awesome, but it wasn't consistent, and we weren't able to answer these really heavy questions that were coming up for us. So maybe you want to talk about that as well.
Yeah, definitely. And if I miss something, Carrie, help me out, because I'm not remembering all of it. But I think what we wanted to do as a first step is to understand, first of all, just what does the need look like, both in terms of the types of violence that are occurring and also the populations that are being served. So within the template, we have information on, for example, family violence and like domestic violence and other types, to help us better understand the unique care that might need to be offered as a result of that. And then we also have information on the populations. So, things like ethnicity, or whether or not there's newcomer status or things like that, because a lot of times if, and Carrie can, I'm sure, speak better to this than myself, but making sure that we're tailoring the care and being prepared to really address the needs of the people that might be coming in either to certain locations or at certain periods of time where we might see influxes. And so those are, I think, the two main bits, but Carrie, I'm sure I'm forgetting something.
No, I think you've got it. So I think part of, like Alina said, when we started, I think part of the design process for me that was really important was that we were not asking service providers to do anything else in addition to what they already did. And so the especially when we were launching during COVID, we know that everybody was super overwhelmed during that time. And so the design was give us the things that you have and we'll figure it out. And that was a really great design from a theory perspective. And then Alina told us at one point, like, the total number of lines of data that had come in, and we were like, whoa, that's a lot of information. And not all of it maybe is helpful or speaks in the same kind of way. And, Lana spoke about this earlier, this sort of creating a system where we actually have apples to apples. And so where we're at as a sector, well, I would like to say we have 15 data points that we can collect that is actually going to be apples to apples. We're not there. We don't actually have that. We have about 2 or 3 that we can collect. And so part of this process is saying, okay, what are the things that everybody already does now that we can be collecting, that we can actually be that ensuring that it tells a representative story and that we're not making a bunch of assumptions. And then if recognizing what the gaps are, what the limitations are of that data, and then saying, okay, what else do we need to add? And what does that look like? And how do we get people socialized into doing that in a way that it feels productive for clients, for the organization, and for the project? And so I think that's been an interesting sort of shift that we've had to make from our sort of launching and our piloting to now sort of running and saying, actually, as we build this airplane, we recognize that we need to dump a bunch of the stuff that's not useful and keep the stuff that's really useful so that we can be telling and understanding that story better from that perspective. I also just wanted to make a comment. So someone in the slides has, one of the questions that was asked was about survival sex versus choice-based sex. I don't know who that person is. It doesn't necessarily fall into Data2Action, but it is a question that I have in the work that Say-Just does. And so I'm going to throw my email in the chat, and I would love to chat with whoever that person is, because I think there's a possible other project opportunity. So I just wanted to say that as I saw that go by.
That was awesome, Carrie. Thanks for that. Jill, did you want to show us some of these themes that are coming up from folks on research questions, and then we can see some of the ones that we're tackling in the immediate term, and we have, because it's one thing, this is another learning, like we want to answer all these things, and then when we look at the data, we're like, oh crap, like we can answer this much right now. And exactly what Carrie's saying, you can't also demand, go to your collaborators and say, now you're answering, 200 questions on a monthly basis. We're like, let's start small and let's build off of it. So I think our immediate priority has been on this service availability and service use patterns, help seeking patterns, to understand needs and gaps, and what might be coming up next, because that's the other side of this, is the future, the prediction work that is also underway. We haven't really touched on it today, but we've done some work through a digital supercluster project, and Lana was part of that as well. And Carrie had to write a letter of support for us to get that funding, to look at how we might predict domestic violence rates. Now, interestingly, domestic violence police reported rates, because that's the only indicator that we have in Canada that we had enough data to work an algorithm on. So you can see the relationship between something like that and this project that's saying, that's cool, but police reported data around domestic violence might go in the future is also prompting us to think very differently about localizing responses, for instance, because the algorithm is suggesting that domestic violence police reports are not going to be the same in all parts of the province. It's going to be a very regionalized approach. And so the implications for that are like, well, we better not have this blunt force, everybody does the same thing model that we sometimes tend to go by using population-based funding formulas, for instance. It's really telling us that we can be much more sophisticated and in a way surgical about our policy interventions if we have better data. So I don't know. Go for it.
Yeah, no, just gonna on your point. I just was with the chiefs of police yesterday across Alberta, and Calgary talking about rates are staying the same, but severity are going up, while Edmonton is saying rates are going up, but severity hasn't changed. And so you start the nuance of that kind of conversation, and what does that mean? And I think that's where we, with Liz and the research committee and your data scientists, we're trying to figure out as well, to your point about how do you reflect those nuances? Because I think that, yeah, when you compare, I think that's stuff we're going to have to work through as well.
Mm-hmm. And I think I see a lot of comments in here about, adding different angles to questions, or how do we make sure that we're capturing this and seeing the effects long term. I think part of the reason why we need to understand these questions, and part of the reasons why we need to define what we're collecting and why we're collecting it, is so that we can build that into the longer term conversations about what's going on in the sector, and actually seeing the results of what different interventions have been, and actually seeing the results of how different forces have changed the ways that people seek for help. My next question for the group is, if we're thinking about sustainability and how we can sustain systems change over time, what are the conditions that need to happen in the social sector for that? And like how does this data collection, how does this data interpretation and analysis and putting it into practice help support that sustainability?
Who do you want to pass the ball to, Jill?
Alina, do you want to give this one a try?
Oh, damn. Okay. How does it support sustainability?
You can pass it to someone else too if you're not ready.
No, it's good. It's good. I'll get it going. I'll get it going. So I'm not sure I'm interested in sustainability as much as doing things better and transforming it for the better. So I'm going to answer it from that standpoint, because I come from the perspective that we can do better. So for me, this work is, and I mentioned it before, if we understand the local variance, for instance, and the uniqueness of place and what's happening in a particular community and dynamics amongst communities, as a policy, if I put my policy and funder hat on, I know that that's not how we do business right now. It's a very like catch-all approach. This is the provincial response. How does it manifest locally? And if we overdo the localization and we listen to the loudest voice, for instance, it may actually not be where the need is. And so what I'm really excited about in some of the projects we have on the go are that building those relationships with Indigenous communities, for instance, and understanding that some of the effects of neocolonialism have created some of the overrepresentations that we see in the data now. And so it's less about sustainability of the current system, but it's using these insights to use data to show the inequities in a different way, in a way that can't be unseen, for instance. The other side of it is that if we can map the services and the systems, and we now understand that we've got this wealth of firepower in a way that is the social safety net, but it's patchworked. So, and that's from a sustainability perspective, sure, we can keep doing that, but I don't think anybody will disagree if I say it's not really working for us. The status quo is not really working for us as decision makers, us as service providers. The silos are not productive, and as end users, the help seekers, it's certainly, I haven't been to a lived experience consultation in the last 20 years where people said, you know what, the system is super easy to navigate. It's really equitable. It's really giving me what I need. It's great. Like, I've heard that never, right? So I think that's the opportunity that I'm interested in, is how can we leverage this experiment through Data2Action to prompt us to rethink how the social safety net should be experienced and how it needs to be transformed to be equitable and focus on well-being and address some of these long-standing patterns that are still manifested in the data in overrepresentation of certain groups as requiring support when that wasn't the case 500 years ago. So that's my interest, and I'll pass that to the next person.
I can go and I'll build off of that, Alina. I think that I agree with you. I think that sustainability for me is less about the sort of sustainability of this particular piece of work or this particular initiative, but it's the sustainability of, are we building capacity and building empowerment and acknowledgement that the systems are broken? How do we deconstruct them and reconstruct them in ways that actually work for that end service user? And I think for me, part of that sustainability comes into the fact that none of us could do this project individually, because it wouldn't actually do what we needed it to do. Help Seeker and Shift could work around something like this, but if they don't have that connection to community and community saying, this is actually what we're seeing, this is actually what we're delivering for services, this is what we're delivering for services, and this is actually what people need, it wouldn't work. In the same way that Impact couldn't do this work all on our own to say, hey, everybody, give us your data and we're gonna, I don't know what we're going to do with it, because I'll be honest, what Alina does to me is like, all the data goes into this magic box, they do some like voodoo thing, and then they spit out a bunch of stuff. And that's great. I don't need to be the person that understands that, because I can go to Alina and say, you're actually the expert in this. Let's be together on that. And so I think that for me, part of the sustainability is that recognition that when we want to actually work with data in this kind of way, and when we want to tell that story, we have to look at how we're doing that collaboratively, not just from we're going to get a collaborative data coming in, but how is the project run, how is the implementation, how is the analysis of all of that also done collaboratively, so that we can ensure that Liz's perspective and Lana's perspective and Alina's perspective and my perspective all come together, because that's actually where innovation and change happens. Otherwise, we end up a little bit doing the same thing we've always done, which I don't think any of us are interested in doing.
There's a question around oversight, which I just love. So thank you to Amber. And part of why we built the research committee which has a collaborative, different groups of people representing different organizations, plus Help Seeker, plus university, was to create that oversight and to speak to, I think, what Carrie just is addressing. And then I'll let Alina speak to her oversight from a technology perspective, but Liz's role is to provide that and to facilitate that and support that from happening. Because the other issue for me is automation is happening, AI is happening, like all these technologies are happening. So I think as a sector, we can either put our head in the sand and keep moving, or we can actually get engaged and try to influence and use it for social good. And I think that's what we're all interested in. And I also think we need to disrupt the systems of sorrow that that Carrie addressed. Our systems are not working for the end users. They aren't in most situations, and we can do better, and we need to do better. And so this is a disruptive project that we do want to dismantle systems that are hurting people. And I think all of us are part of that. The social profession has a huge history in doing that. And so how can we not create harm through this process? And I think we're trying to put in place multiple oversight systems to ensure that we don't do more harm. We're actually trying to create social change.
Yeah, this is it, right? How do you do technology in an ethical way? And there's a bunch of ways that you can do it from a technical perspective that I always say I'm going to embarrass myself when I start talking about machine learning, because I'm a social scientist, but I happen to run a tech company. And so the questions that we ask, and it's interesting because we have half the team that's on that side, and the other half that's a bunch of Marxists that we are, reforming Marxists. So we're in constant tension internally. Number one, I think it's about building a culture that that puts these values first and embeds them in the culture of the organization that is developing the technology. The other part is the people working on developing that technology. Are they trained in OCAP principles, for instance? Our team has to have certification to do work on this type of stuff from that body. And there's so much other stuff that needs to go behind it that is not typical in a tech company. What we're trying to do is build a culture that has that ethics and core values built around reconciliation, equity, diversity, and inclusion, and build that into the fabric of who we are, so that is the lens through which we do all of our work, and vice versa. All of the social innovation work has to obviously have that lens. And it's a little bit easier for us on the social side because we're in community all the time. We're working with Indigenous communities, we're working with racialized communities, et cetera. But it's easy to be behind in the code and forget about that. So how do we do that? We have to constantly do that education and build champions in our team, and socialize these concepts around being critical about data. I think me and Lana would always text each other when we had some of our team members start on the data science side, and they would say, data doesn't lie. We're like, oh no, data lies all the time. Like, absolutely it does. So you actually have to I don't want to say re-educate, but add another layer to the education of the folks that are in the technology side to understand it. And that's our value as social scientists to that space, because I think there's well-meaning people in the tech sector, and they might not realize the harm that is being done, but we need to give them a new way as well. Like, we can't just critique, we need to show them a path forward that is equitable, that is ethical. So I think that's our contribution. The safeguards, there's lots of standards and in doing AI research and machine learning and all of that. But I think it's much more beyond a policy. I think it's living and breathing it in the culture of your organization that is so important, and not losing sight. The connection to lived experience is huge. Oh yeah, there's a couple of thanks, Alan. Alan's our friend from Max Bell. He's giving you, if you haven't done the OCAP training, it's great. It's great. And we've got a really cool relationship with FNIGC, which is the organization that runs the OCAP training, because they're part of our kind of our collective advisory on this. We have, for instance, an elder in residence that is always keeping us honest. We've got folks that are very diverse in our team as well, that bring those perspectives and the lived experience perspective. So 70% female or non-binary, 50% or I think more now that are racialized community members. So our hiring practices you can't just talk about it, you got to prove it as well. So all of that really, really helps to keep everybody on, not honest, because I think we're all honest, but on the right track. Thanks.
Alina, there's been some questions about cost to community organizations. And so I just wanted to take a minute to chat about that, to say that there is no cost associated with the program for the community organization. So this is a funded project, and we've been funded through, as Minister Luan said at the beginning, we received some funding through the Civil Societies Act. We've also received some funding from the Canadian Women's Foundation as part of pandemic recovery kind of funding, and other funding from the government of Alberta to really start this at the beginning of COVID when we were in that. And so one of the things that is really important, I think, is that there is no cost associated for the community orgs. And it's part of actually why we looked at what data do you already have that you can share with us perspective, because we recognize that we can say, well, you don't have to pay us to do this, but we're going to ask you to ask these 5 other questions, and that there's cost associated with that. And so part of the design is, what do you already collect? Can you give us that, fill out this form for us with these, 3 to 5 data points, because you already have that data. And so you already have staff who are doing that, who are collecting that information and putting that all together. And then the cost of the operating of the project teams, of the implementation, all of that is all supported through government grant or through foundation grant, so that we're not having to pass that cost off to organizations and not having that as a barrier to being able to participate.
On that note, I think this is a good time for me to do my little pitch about if you want to be a data collaborator. Lana and Alina and Carrie and Liz, you all talked so much about, the inspiration behind this work is for us to create better systems, and is for us to make sure that, whatever investments we're making are actually going back to community and they're actually benefiting community. And how do we make sure that, that's the central lens. That's essentially the outcome, the goal of all of this work. One thing that we're doing right now is we're recruiting data collaborators. So if any of this resonates with you, if any of this sounds interesting, if you want to be a part of this initiative, you can contact Impact, so impact@sages.org. It's a super easy process for people that do want to contribute data. You'll have full control over your permissions, like whether it's used in research, whether it's anonymous, whether your organization's name is attached to it. The process is super easy. It's just a monthly submission or a quarterly submission whenever you're doing that, so you can build it into your existing processes. But really, this is such a big opportunity for Alberta. This is such a big opportunity to be pushing social innovation, to be pushing social technology. So we invite you, if anybody's interested, to take part in this and to put your organizations out there. We'd love to see what exists. We'd love to support the sector with building these new ways and transforming it. So let us know. Feel free to reach out. I know that we have about 5 minutes left, so maybe if we have 1 or 2 more questions from the audience that we wanted to address, this is probably a good time to do that.
I had one question that I didn't answer in the Q&A around, and I think this is a good one, like, as what can you do? So beyond joining, if you're not in Alberta, you know, advance this idea in your local jurisdictions as well. I think if we have a national picture, can you imagine how powerful that would be for us as a sector? Like it's like amazing. So that's one. The other one was the question around training around data and anything to brush up on. I would really encourage you, again, I put the link in the chat, FNIGC, the First Nations Indigenous Knowledge Governance Center, sorry, getting my acronyms mixed up. They have a great training on data collection about Indigenous people, and given, you know, this is part of our reconciliation work, I really encourage you to take that course and get the certification. The other ones might be something that other folks can suggest, like more general courses around data collection for service providers. I know at Help Seeker, we do have curricula as well and courses that come up. So I know we've got one on advanced systems mapping, and I know we just did one on integrated funding. Anyways, there's always courses. I think we have monthly courses that happen. Those are just more in-depth and more interactive in smaller groups that are obviously might be of interest as well. But I'll hand it over if anybody knows some good courses that people can take to brush up on
I
data.
think if people want to connect with Liz, and Heather Kraus was part of our initiative for the first year, and she has a great website with tons of courses to take that around data equity frameworks and how to integrate it into your research questions and your work. There was a question from Nick, the panelist: how will all the tech and digital data affect advocacy? And I'm so happy you asked that question, and it's a great way to end. A lot. We're hoping a lot. I mean, the sole purpose of this initiative is to affect change and hopefully to inform policymakers, decision makers, systems leaders, community-based organizations and leaders to transform the sector to better serve, but also to prevent violence before it starts. And that is where the AI, predictive analysis, and trying to better understand what's actually happening in real time and what can we do and how can we better organize ourselves to better support prevention. And so I think at the soul of this initiative, it is around social justice and change. And as Alina mentioned, reconciliation and social justice principles of getting, you know, a more equitable society and stopping violence before it starts. So I don't know if Liz or Carrie want to end on.
No, that seems like a great place to end. I think that's the goal, right? That's the thing that we're all looking to do, is to you know, put ourselves out of business so that we can retire on a beach somewhere. So if we can actually use data in a way that helps to do that, that would be great.
Okay. Thanks, everyone. Thank you so much, Lana, Liz, Carrie, for joining today. All of your perspectives were super, super interesting, and I'm a part of this project every day, but I'm still always inspired to hear the three of you talk, and you as well, Alina. If there's no final notes, I think we'll let everybody go. This presentation will be sent out to everybody. You'll get the slide deck, you'll get the recording, and you can keep an eye on your inboxes from that. But I just wanted to say a big thank you again to our speakers. This was a really wonderful webinar. And we'll see you soon. Everyone can have a great day.